So from the patient's perspective, when the discussion is started about tapering off of opioid medications, it's a very sensitive conversation. As someone that experiences chronic pain all of the time, it's unrelenting and it is consuming. To have any sort of a break in that type of pain level is something that you really, really are appreciative as a patient. So there's a lot of fear, and as a patient, you're not in a position where you feel that you have direct control over your care. When you're dependent upon a single person for pain relief that exponentially improves your quality of life, it can be a really scary situation.
About 10, 15 years ago, my doctor had broached the subject with me that we would have to stop or reduce the amount of opioids I was on. So I was taking 450 milligrams of morphine a day. And I was a bit hesitant at first, knowing that they were giving me some relief, but I wasn't getting the relief that I was hoping to get from them. So it didn't come as a big shock to me when he mentioned that. In fact, the longer I thought about it, the more it made sense for me to reduce. Not only did I reduce it, I went completely off of all morphine. I did it on my own. I didn't take Suboxone. I didn't go to a rehab. I have to say I went through 5 days of not being very healthy because I was going through the withdrawals that normally occur with the opioids. It was almost as bad as the pain I was going through. I have to give my doctor a lot of credit for was that he really worked with me. Sitting there and talking to me as a normal person, not a patient to doctor, but as a normal person, really, really helped me make that decision that yes, it was indeed time for me to stop the opioids. In that respect, he was wonderful for me, and he agreed, and we both sat down and talked about it and agreed that it was the best thing for me to do. And in the long run, it certainly worked out to be that way. I wasn't real happy with the way the morphine was changing my personality. I would have extreme highs and lows. I had no ambition to do anything. I'm tired of not being able to do the things that I used to do. To do things with my family that I never got to. I never got to play ball with my son. I never got to do anything with my children. It hurts me tremendously. And the pressure is great on me because I want to feel better. I don't want to be lying in bed all the time. I don't want to be stuck on medication for the rest of my life. I want to have a life. And that's the pressure that I put on myself, is that I want to have my life back. And I haven't had my life back in over 23 years.